Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Therapist London. At some point in our lives, many of us consider consulting with a psychologist, psychotherapist or therapist in London for one reason or another. Not everyone who seeks counselling is burdened with the same troubles. Nowadays, psychologically minded men and women consider consulting with a mental health professional for personal growth and development, as well as problems in living. Individual adult counselling is a process by which the client is invited to look honestly at their behaviour and lifestyle and make certain decisions about the ways in which they, in London, provide support and warmth, yet enough care to challenge and comfort. The counselling process begins with the client and the therapist coming to a joint understanding of the client's issues and self-defeating patterns that may be preventing the client's growth and interfering with their ability to meet personal and relationship goals. Brief or longer term counselling. The goal of counselling, and sometimes accomplished by adults in a brief intervention therapy. Some clients, however, require more time to engage in significant exploration of their problems in living. In individual adult counselling, clients can develop a more compassionate view of themselves, resolving painful past experiences, and reduce negative self-talk and increase positive self-talk. Interestingly, gaining a better understanding of ourselves can improve intimate and family relationships, promote inner peace and inner strength, and perhaps most importantly, foster personal growth and development in adult life. Some issues that adults may address in counselling include anger management, anxiety and OCD, assertiveness, body image, boundary setting, communication challenges, court-mandated counselling, cross-cultural values, depression, eating disorders, grief and loss, interpersonal skills, low self-esteem, parenting, power and control, sexual issues, sexual orientation, social difficulties, stress and burnout, survivors of violence. Though a scholar-practitioner approach to therapy, our therapists in London operate from an empirically informed treatment modalities, including contemporary relational psychodynamic psychotherapy, dialectic behaviour therapy or DBT, acceptance and commitment therapy ACT, as well as cognitive behavioural therapy CBT. Our integrative and contemporary approach allows for flexibility in the moment should new stresses or crisis arise, whilst maintaining a focus on the overall treatment plan, working through it versus getting over it. Our expertise lies in developing a collaborative therapeutic relationship with you and establishing goals together. Our clinicians operate from a place of non-judgment and do not believe that there is anything wrong with you as a person. There is an understanding that each of us encounter obstacles in our lives in which the world expects you to just get over it and move on. Our belief is that if it was so easy to just get over it, in all likelihood you would have done so already. Life's obstacles and circumstances are difficult, and each of us were not always dealt the best hand to tackle what comes at us. Our therapists in London understand that it's not about getting over it. Rather, it's our expertise to support, understand and hold you accountable while we work through it together in the context of therapy relationship. Find time to therapy. Our clinicians also specialise in providing therapy to those who have never experienced therapy before, oftentimes recognising that we might need help and then seek support from a professional takes a tremendous amount of courage. Our clinicians recognise this and strive to make the initial process as seamlessly and easy as possible. We offer complimentary phone consultations in which you can speak directly to a clinician, oftentimes the clinician you will likely be working with. Our therapists in London are compassionate and understanding and recognise that seeking therapy for the first time is scary, even though it does not have to be. Psychotherapy, sometimes called talk therapy, addresses personal difficulties and concerns. It gives you a space to speak openly and confidentially about your concerns and feelings with one of our trained professionals. Together with your therapist, you will develop a confidential and trusting relationship to discuss problematic thoughts, feelings, or behaviours. There are many issues that psychotherapy can help. See our services page for our comprehensive list. Some common concerns in individual psychotherapy are anxiety, depression, self-esteem, relationship issues, disordered eating, sleep difficulties, indecision, trauma, panic attacks, behaviour change, grief, loss, identity issues, and stress. While attending therapy can sometimes feel daunting and nerve-wracking, our therapist's job is to make you feel comfortable and able to share your thoughts and feelings. The therapeutic relationship is unique, unlike a friendship or a family relationship. The structure and uniqueness of the relationship, with strict boundaries and ethical guidelines, are what enables trust and change to happen. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast, which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media, and we will answer those questions in upcoming either video content, and of course, when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.